Welcome to Anatomy on Demand, and in this video we are going to be learning about the cranial nerves and the structures that are associated with them and the skull foramina. So let's go ahead and get started. There are 12 pairs of cranial nerves and they're all on the undersurface of the brain. So for ease, in today's lecture we are going to be referring to the picture on the right a lot, which has all the cranial nerves done in different colors. But make sure at the end you can go back to the picture on the left and identify all the structures we talked about on that one as well. Also, make sure you look on your lab materials and look at all the model pictures and practice labeling there as well. So there are 12 cranial nerves, so there's 12 on the right and 12 on the left. So just do a mid-sagittal line, and they're actually going to go pretty much in numerical order, 1 through 11, and then you just come in a little bit for number 12. So I'll be pointing them out in various parts of the brain. So we're going to start with anterior. And anteriorly, there's a couple structures we need to learn about before I start talking about the cranial nerve. And that is on the undersurface of the frontal lobe, there is a structure called the olfactory tract, which is a group of axons. And it leads to a larger swelling where there are going to be some cell bodies, and that is called the olfactory bulb. Now, the olfactory bulb sits right on top of the cribriform plate of the ethmoid bone, just on the two sides of the crista galli landmark in the mid-sagittal plane. And if you recall from your bony anatomy that there are little tiny foramina in the cribriform plate. And it's through those tiny foramina that we are going to have neurons that go between the nasal mucosa and the upper part of the nasal cavity through the foramina into the olfactory bulb. And these are the olfactory nerves. Now, some people may mislabel the olfactory bulb as the first cranial nerve, but it is not. These are the actual nerves. So that brings us to these, oh, and by the way, the function of the olfactory nerve is the sense of smell. Now that brings us to the second cranial nerve, which is the optic nerve. And the optic nerve comes off the back side of the eyeball, and it's only going to give us the sense of vision. It exits the orbital cavity through the optic canal. And so all of that is still the optic nerve. Then what happens is some of the fibers in each optic nerve are going to cross to the other side, thus giving us an X-shaped structure known as the optic chiasm. So half the fibers stay on their side and half the fibers will cross to the other side. After the chiasm, the axons will continue towards the brain and the structure known as the optic tract, which is clearly visible on the undersurface of the real brain. When you look at the drawing, what you will notice is that you cannot see the optic tract because this round structure in the midline, that's the pituitary gland, which sits right over where you would be seeing the optic tract. In comparison on the brain, right there, you can see the little stem of the pituitary gland. And because the pituitary was cut off, that is why we're able to see the optic nerve, chiasm, and tract so clearly. So those two are both sensory, so they're carrying information towards the brain. Now we're going to move more inferior. Okay, so we just finished up here with the optic nerve, the second cranial nerve, and right here is where the pituitary gland is going to go. So the next structure we're going to go to is not the midbrain. There are no cranial nerves that come off the midbrain, but we're going to go to the pons. And on the superior surface of the pons, let's divide it in the midline again, starting really close to midline, that's where the third cranial nerve will come off. And then way out there in the corner, that's where we're going to see the fourth cranial nerve. And as we come down part way, we're going to have the really big, thick fifth cranial nerve. So there's only going to be 3 cranial nerves coming off the pons. After that, we'll go back towards the midline of the medulla oblongata, and we'll do 6, 7, 8, 9, 10, 11, and then we'll go in a little bit for 12. But you'll see that as we go along. So the third cranial nerve is the ocular motor nerve, and it's one of the 3 nerves that are going to move those extraocular muscles of the eye. And so the ocular motor nerve comes off the anterior part of the pons, and then it's going to travel through the superior orbital fissure to get to the eyeball, where it's going to divide into 4 branches to go to 4 muscles: the superior and inferior rectus, the medial rectus, and the inferior oblique muscles. So yes, as soon as you learn the names of the muscle on special senses, you need to know the names of the muscles that are innervated by the ocular motor nerve. The 4th cranial nerve is also a motor nerve, and it is going to innervate 1 extraocular muscle, specifically the superior oblique muscle. And it is the skinniest, most delicate of all the cranial nerves, and oftentimes students have trouble finding it because they're looking for something big like the ocular motor nerve, and it's much more delicate and it comes off much deeper, and you just kind of see it sneaking its way up there. And the trochlear nerve is also going to go through the superior orbital fissure to get to the eye muscles. So that brings us to the 5th cranial nerve, which is the trigeminal nerve. And it's quite large because, as the name implies, tri meaning 3, this one is going to have 3 branches. So oftentimes on models, you will only see the really thick stubbing of the trigeminal nerve. Sometimes you will see all 3 branches, like on this one on your left, but on the brain's right side, you can see all 3 branches of the trigeminal nerve, whereas on the brain's left side and your right, as you're looking to it, it has been cut off. So the trigeminal nerve as a whole is what we call a mixed nerve, in that it contains both sensory and motors. So you have to learn the 3 branches of the trigeminal nerve and each individual pathway and what they do. So the first branch, which is called V1, V for 5 and a little sub 1 because it's the first branch, is the most medial or most superior of the 3 branches, and that's known as the ophthalmic nerve. I want to point out the spelling is O-P-H-T-H because a lot of students misspell that ophthalmic word. It's a little bit difficult. And the ophthalmic nerve goes through the superior orbital fissure, and then when it leaves the eye socket, it goes through the supraorbital notch or the supraorbital foramen, bringing it out right about here, which explains why its function is sensation up here in the upper part of the face and the head. And that's all there is for the ophthalmic nerve. So that brings us to V2, which is the maxillary nerve. And so the maxillary nerve exits the skull. If you look on the bottom left, there's the first branch going to the superior orbital fissure, and here's V2 going through the foramen rotundum right there. And then from the foramen rotundum, it's going to end up coming out here in the infraorbital foramen. And so it's going to give a sensation here in the mid-face area and a little bit here on the side of your temples as well. So both V1 and V2 are purely sensory, which means V3 has to be the one that has a motor component. But V3 is actually a mixed nerve on its own. It contains both sensory and motor. So if we look at the bottom left picture, what you'll notice is the V3 branch is it's exiting the cranium through the foramen ovale. And then from there, it's going to enter the mandible through the mandibular foramen on the inside of the mandible, then travel within the mandible, and it will exit down here in the mental foramen. And that will give us sensation here in the lower part of the face. But in addition to that, we have branches of the mandibular nerve, which are going to go to some of our muscles of mastication. Okay? So at this point, you should know what the 2 of those muscles are at least. All right, continuing on, the 6th cranial nerve is the abducens nerve. And the abducens nerve is the first nerve that we're going to deal with that comes off the superior part of the medulla oblongata, clearly seen here. And it is the 3rd and final nerve to move an extraocular muscle. So since it's going to the orbit, it is going to exit through the superior orbital fissure, just like 3 and 4 did. And then the muscle that it innervates is the lateral rectus on the eyeball. Okay. Cranial nerve 7, the facial nerve. Has nothing to do with sensation of the face because that was already covered in the 3 branches of the trigeminal nerves. So cranial nerve 7 is, although it is sensory, it's not sensory to the face, okay? So when we look at it, oh, the arrow's in the wrong place. It should be pointing right here at this green structure. That is the 7th cranial nerve. My apologies for the arrow being in the wrong place. And then the facial nerve exits the skull through the internal acoustic meatus. And from there, it has a lot of branches. It's got like 5 different branches that go on your face. And of course, every branch has a name, but we're not going to bother learning them. So it's going to do a lot of different things. The first thing it's going to do is give you taste on the anterior 2/3 of the tongue. So if you remember your face is anterior, then you can remember it's the anterior 2/3 of the tongue. In addition, all those muscles of facial expression that you have learned, they're all innervated by the facial nerve. So not the muscles of mastication, but the muscles of facial expression. And then the facial nerve is the 2nd of 4 nerves that has a parasympathetic component. And it does a lot with the parasympathetic nervous system. The first thing it does is it's responsible for tears coming from your lacrimal glands up here next to your eyeballs. It also affects 2 salivary glands, the 2 salivary glands which are inside your mandible. They're called the submandibular and the sublingual gland. Both of those glands are controlled by the facial nerve. And I don't recall if when I was talking about the 3rd cranial nerve, the ocular motor, that had a parasympathetic function as well, and that was pupil constriction. All right, so moving on, we're in the 8th cranial nerve, which has that really long name, vestibulocochlear nerve, because basically it's 2 sensory nerves that have merged together, one coming from the cochlea and one coming from the vestibule. And so this one is going to be entering just lateral and slightly inferior to the 7th cranial nerve. And then it kind of makes sense if it's coming from the inner ear and the temporal bone that this sensory nerve would be passing through the internal acoustic meatus as well. So it gives the senses not only of hearing, but also all of our types of equilibrium, which you'll learn more about in lecture. Cranial nerve 9 is the glossopharyngeal nerve, and it is both sensory and motor. So if you look at the name glossopharyngeal, glosso means tongue, and pharynx is the inside of your throat. So what it's doing is giving us taste to the tongue, but if you think the throat is posteriorly, it's giving us taste in the posterior 1/3 of the tongue. In addition, there is a muscle in the neck, in the throat, whose name we are not going to learn, that it gives motor to. And then the glossopharyngeal is the 3rd of 4 nerves that has a parasympathetic function. And its function is that it gives saliva, but it gives saliva from the biggest salivary gland, which sits just superficial to your masseter muscle right here in front of your ear. So glossopharyngeal nerve is here for innervating the salivary gland. Okay. And the facial nerve is getting the 2 down there. After the glossopharyngeal nerve, we have the most important cranial nerve of all, and that's called the vagus nerve, which means the wanderer. And that's because this nerve is the only one that really goes below this level here, okay? And it wanders throughout, its branches wander all the way throughout your thoracic cavity and your abdominal pelvic cavity. So it's going to be innervating all of those viscera that you have yet to learn about. So it is both sensory and motor. The sensory it does is taste to the very, very back, what we call the root of the tongue, where the tongue is attached. So not even the whole posterior 1/3, but just the root of the tongue. There is some movement of some muscles in the neck that we're not going to learn about, but the big important part is the parasympathetic innervation to all your viscera. And this is going to be really important because this has to do with controlling your digestion, with controlling your heart rate and your blood pressure. So as you can see, this is not a nerve that you want to have a problem with. Okay. And it exits along with the glossopharyngeal and the accessory nerve 9, 10, and 11 will all exit the skull through the jugular foramen along with the internal jugular vein. So the 11th cranial nerve is called the accessory nerve. It used to be called the spinal accessory, but they changed the name. And here's why it used to be called the spinal accessory. It's this structure here, which looks kind of like a centipede. In other words, it has all these rootlets, which are actually coming off the superior portion of the spinal cord. And then they merge together and they go through the foramen magnum to re-enter the cranium. And then both the rootlets that are coming off of the medulla oblongata, as well as the ones that came off the spinal cord, then they all will exit the cranium together through the jugular foramen. And what the accessory nerve does is it comes down here into the upper shoulder area, and it's going to innervate exactly two muscles, and you know them both. The two muscles it's innervating are anteriorly, it's going to be the sternocleidomastoid muscle, so you can flex and you can rotate your neck, and posteriorly, it's going to be innervating the superior fibers of the trapezius muscle. And now we have the last but not definitely very important as well, the hypoglossal nerve, because I've been using it a lot in the last 20 minutes. And the hypoglossal nerve is motor only. And where it is motor to, if you look at this picture in the bottom middle, you can see that the nerve is going to the undersurface of the tongue, thus hypoglossal, underneath the tongue. And it gets there by going through the hypoglossal canal, which is in the occipital condyles, just like at 10 and 2 o'clock next to the foramen magnum. And the function of the hypoglossal nerve is to move the tongue, just thus enabling, you know, the first part of swallowing, a lot of talking, a whole bunch of activities with your tongue. And with that, we are just done discussing the cranial nerve. And so this picture I put up here, in case you want to pause it, it's still in color. So it's a good first attempt to try to label all the nerves and to understand where they're located. And then the other half, I actually put the inside of the cranium so you can kind of correlate which cranial nerves are going through which openings. And when you look at the pictures, go back to the pictures of the nervous system, which were posted previously. In there, there's lots of pictures of cranial nerves, and there's also pictures looking at models in the floor of the skull where you can see the cranial nerves going through the different foramina. And I have posted pictures both labeled and unlabeled so that you can check yourself to make sure you have this, because I know this is a difficult aspect for students to learn. So I want to thank you for all your hard work, and I will see you again soon.